All right, looks like it's starting to slow down a little bit, and we got a lot of content for you all today, so we'll go ahead and get started. Thank you so much for joining us for actually our last webinar in our 2020 HealthLinks webinar series. We are already beginning the planning of our 2021 series and have a lot of fun topics coming up, so definitely stay tuned for that. This one, of course, is on how small businesses should engage employees to achieve total worker health. And my name is Katie. I'm the program coordinator here at HealthLinks, and I'll be getting us started today. For those of you who may be here for the first time, welcome. I want to tell you a little bit about us before we get started. So HealthLinks is a mentoring program based at the Center for Health, Work, and Environment, and we champion health and safety at work. We do this by offering evidence-based healthy workplace certification and advising to help organizations achieve total worker health, which you'll be hearing a lot about today. For those of you who are in our network, hopefully these benchmarks look familiar. If you're not, no worries. But these are the 6 different areas that we assess and advise on in HealthLinks. Our topic today of engaging employees, of course, falls under our engagement benchmark. Just a quick agenda for you today. We have Dr. Natalie Schwatka here to give us a wonderful presentation. Then we are also joined by representatives from Royce-Hurst Humane Society and Active Pharma Group to give you a little insight on how they engage their employees at their small businesses. Then we'll have some time for question and answer, so make sure to save your questions for that. And then we'll just have a brief closing with some wrap up and what's coming up. General housekeeping, all participants will be kept on mute throughout the duration of the presentation. You can use the chat function for any technical issues. We have Kira Litvin here to help you if you're having any trouble with audio or things like that. If you have a question for our speakers, though, please use the Q&A box in the control panel on your screen. That's where we'll be pulling all the questions from at the end. This webinar is being recorded. We'll send out the link in the follow-up email. So if you want to go back and revisit something or know someone who wasn't able to attend, you can watch the recording. We will also have a survey at the end of this webinar. This is really important for those of you who want to claim CHES credits. We have a quick quiz in there for those of you who are wanting those credits. So please take a minute to complete this. We'll also be sending out the link in the follow-up email. So if for whatever reason it doesn't pop up when you close out, it will be coming. But we would love to get your feedback as well. So please take a minute to complete that. And as I just mentioned, we have CHES credits available and SHRM credits. All right, I am very excited to introduce our speaker today, Dr. Natalie Schwatka. Dr. Schwatka's primary research focus is on developing small business leaders' capacity to protect and promote their workers' health, safety, and well-being, called a total worker health approach. Currently, she is a co-investigator on a National Institute for Occupational Safety and Health, or NIOSH grant, that seeks to understand how to change small business total worker health practices. She recently received a NIOSH Mentored Research Scientist Development Award, or KO1, to examine the predictive relationship between small business total worker health strategies and leadership practices, their influence on health and safety climate, and ultimately their influence on employee motivation, practices, health status, and employee productivity. Dr. Schwatka is an assistant professor within the Department of Environmental and Occupational Health, where she teaches total worker health courses. She is also the co-director of the Certificate in Total Worker Health program, which I believe we'll have a little bit more information on in a bit. So welcome, Dr. Schwatka, and take it away.
Awesome. Welcome, everyone. Let me just pull up my presentation. It'll take maybe 10 seconds to get things rolling. Thank you so much for tuning in today. I'm excited to share the results of some of our research with small businesses here in Colorado. Just a couple more seconds. Okay. All right. Everyone should be able to see the slides now. So welcome, everyone. My name is Natalie Schwatka. Thank you for the intro, Katie. Today, I'll be talking about how small businesses, or really businesses in general, should engage their employees to achieve total worker health. Now, Katie already explained, the HealthLinks program, but I wanted to just make you all aware that HealthLinks is part of the Center for Health, Work, and Environment. It's a broader center within the Colorado School of Public Health at the University of Colorado Anschutz Medical Campus. And we are one of 6 centers of excellence in total worker health and one of 18 centers for training in occupational safety and health. And our mission is to advance worker health, safety, and well-being. And we're very happy to bring you this presentation today. And throughout our webinar today, we're going to first learn about the 4 different approaches to total worker health based on data from our Small Safe Well study with Colorado employers, and then which approaches elicit the best employee engagement. And we'll get to hear strategies from model employers in the HealthLinks network, who both of which were in our Small Safe Well study, who participate in HealthLinks and who've been in our leadership program. So I'm very excited to have them on the panel to hear their perspective on these topics. So today we're talking about how we can achieve total worker health. And so what in the world does total worker health mean? It means that in the past, you're in occupational health and safety, our goal has always been that everyone goes home the same way that they came to work. We don't want work to be a source where people are injured or made ill because of the hazards that they're exposed to at work. But our vision in total worker health is that everyone goes home in better health than the way that they came to work in. So we envision a world where the workplace can be both a place where your health is protected, but it's also promoted. And the way that we achieve total worker health is by prioritizing changes to the working environment. And that's going to be the big focus of my talk today, the features of the work environment that we can change to improve health in the workforce. And we prioritize these changes to the work environment before trying to use sort of educational or personal behavior change strategies. That's not to say that there isn't a place for them in your total worker health approach, but it's really important to think about the upstream or working environment factors that impact workforce health and how we can change those. So what is the working environment? So in our view, the working environment includes 3 key things. The first are total worker health business strategies, and I'll go through each of these in detail. But the first are the business strategies that your business uses to, the policies and the programs that you use to protect and promote employee health. The second feature is leadership, the leadership that supports these strategies in practice. And finally, the climate. And I'll talk a little bit about more what I mean about climate. It's not temperature. All 3 are important aspects of the working environment that shape how healthy and safe we can be at work. So let's talk a little bit more about each of them. So business strategies. What is your business strategy for total worker health? And the way we think about that are the HealthLinks benchmarks. So Katie mentioned them initially. There are 6 of them. And I'm sure many of you on the webinar today are familiar with the 6 benchmarks that HealthLinks uses. And they reflect key policies, programs, and practices that your business should undertake to create a working environment supportive of total worker health. There are benchmarks for workplace safety policies and programs, as well as your health and wellness policies and programs. But we believe that a total worker health business strategy should also include organizational supports like resource allocation, benefits, et cetera. An assessment strategy so that you know what your employees' health and safety needs are. Engagement strategies to ensure successful communication and engagement with employees. And finally, an evaluation strategy to make sure that you're continually evaluating the way you're doing things and making improvements as needed. The second feature is leadership. And by leadership, I'm referring to what employees think about their leadership's commitment to health and safety. And there are a few ways that leaders can demonstrate that they're committed to health and safety. The first is allocating resources, setting a budget, allowing for personal time to manage this. Being role models, super important for leadership in companies to be role models for health and safety. Communication, so communicating the importance of health and safety in the organization. Recognition, recognizing people for participating in health and safety efforts, recognizing the efforts of those that lead health and safety programs, and accountability. So holding folks in the organization accountable to health and safety goals and practices. The last feature is climate. So, and by climate, I don't mean the temperature that your business has, but I mean it as an indicator of your culture. So safety and health climates reflect employee perceptions of whether their organization is committed to their health and safety. There's a lot of research out there that shows that these perceptions are good indicators or snapshots of your company's culture at one point in time. And they stem from observations about what are the true priorities at work. Is safety and health more important than getting the job done and making a profit, or is it equal? But what are the real priorities of health and safety at work? And what actions are supported and rewarded, especially when it comes to relationship with supervisors? Are supervisors supporting the use of total worker health policies and programs and practices? And inconsistencies. So we're really good at figuring out what or observing what's supported in one instance and not supported in another. So inconsistencies are something that folks can pick up on and really play into climate perceptions. So just in summary, just so that we're clear about what each of these features are. The business strategies are your business policies and programs, AKA the health things benchmarks. Leadership reflects employees' perceptions of resource allocation, role modeling, communication, recognition, accountability. And climate, again, doesn't represent temperature, but represents employee perceptions of how much their organization is committed to their health and safety. And all three of these things provide us information on the characteristics of the total worker health working environment. These are the key features that we can look to if we want to improve workforce health, safety, and well-being. And this is because because these are really good indicators of the working environment, and they're actually indicators of employee engagement. And our research and that of others shows that these factors are positively related to behaviors in the workplace. In other words, if your organization has a total worker health business strategy, you have the leadership and climate to support the strategy's use in practice, you're more likely to have employees who are engaged in your programs. And this is because you've increased their internal motivation. This internal motivation is very powerful because it reflects an internal drive to do something. You do it because you want to do it. Compared to sort of external motivators where you're driven by things like incentives, which to a degree can help elicit employee engagement. But when you remove the external motivators, behaviors tend to lag. And so what's really key here is that when you attend to these three things, you are increasing that internal motivation and driving employee engagement. So the question for us was, how are Colorado small business implementing these three key features of the work environment? I suspect that every organization does not have all three of them, and there's probably some variation in the differences in ways that businesses are implementing their strategy and their leadership and climate. And to answer this question, we use data from our Small Safe Well study of Colorado employers, which we're finishing up this year. It was a 5-year study with funding from the National Institute for Occupational Safety and Health. And our focus in this study was helping small businesses change the way that they approach total worker health. Businesses were in an intervention. They participated in Health Links. They did our total worker health leadership training program. And we collected assessment data that helped us get at the business strategies, the leadership, and climate. So just so you know a little bit about the sample behind the results I'm going to show you, we had 97 businesses in this study. Most of them were pretty small, 11 to 50 employees, but they came from a wide variety of industries, which helps us provide some more generalizability to our findings so that they apply to lots of different businesses of different sizes and industries. We had almost 3,000 employees represented in the tell you about. The average age was 41, about 2/3 were female, 14% were Hispanic, 92% were white, about half were in a non-management role. They had been with their employer for about 5 years, and 33% had made less than $50,000 in annual household income. So that's the sample of businesses and employees and the results that I'm going to share with you now. So how do we measure total worker health characteristics of the working environment? How do we measure business strategies, leadership, and climate? We did this by accessing data from the Healthy Workplace Assessment, which employers take as part of Health Links. It assesses their business strategy and 6 key benchmarks, which I mentioned earlier. And then we also collected data from the perspective of the employee from the Employee Health and Safety Culture Survey. And we asked employees about their perceptions of leadership commitment to safety, to health, as well as safety climate and health climate. So the key feature here of how we're measuring the work environment is that we're asking things of the business. So what's going on at the business level, but we're also asking about this from the perspective of the employee, which is really important. So to answer our question about how businesses are implementing these, we used a statistical technique to identify the different patterns of approaches with the scores from these assessments. And as you will see, we're able to come up with different groups that represent different approaches to total worker health. And from there, we could determine which of those approaches were most related to employee engagement. So what we found was that there were 4 groups. There are 4 different strategies that small businesses are using to engage their employees. I'll go over each of them in detail, but I want you to notice that I put red pages next to the slide to note where the approach is excelling and where it lags. So the green full gas gauge bar represents a strategy where they have higher than average scores than most businesses. And the red low gas gauge icon represents situation where they have lower than average scores. So again, there's the beginner approach, there's a focus on business strategy, a focus on business culture, and an approach where they're focused on both strategy and culture. So the first group that we found was groups of employers who are sort of at a beginning stage. Employers in this situation had the lowest or second lowest average scores on all of the indicators that we measured from the Health Links Healthy Workplace Assessment and the Employee Health and Safety Culture Survey. So this shows that this group has room for improvement in both their business strategy as well as their leadership of them and the climate that supports their use in practice. The next approach we found was groups of businesses who are very much focused on their business strategy. So they had the second highest scores on their Health Links Healthy Workplace Assessment, but they had low scores on the Employee Health and Safety Culture Survey. So they're excelling at creating the policies and programs for total worker health, but they're lagging in sort of those cultural aspects. The third group we found was businesses who are focused on their culture. So they had the second highest scores on leadership and climate indicators, but they had lower scores on their business strategy. And finally, we had a group of businesses who were both focused on strategy and culture. So they had the highest scores across the board on the Health Links Healthy Workplace Assessment and the Employee Health and Safety Culture Survey. So we have a poll. Which approach you all think was the most common with our sample of employers. And I think Katie pulled up a poll here, and I take a minute to pick the one that you think is the most common that employers use.
A lot of answers coming in, so I'll just give it another moment.
Great.
All right.
All right, so it looks like about half of you thought that the business strategy focus was the most common group. 23% said the beginner group, 13% said culture focused, 12% said they excelled at both strategy and culture. So actually, let me pull up the results. We actually found a pretty good split between all of these. About a third were in the beginner category. Again, almost a third were in the business strategy, a third were in the business culture focus, and a few of the businesses fell in the business strategy and culture focused group. So we had a pretty good split in the different approaches that small businesses here in Colorado are taking to implement a total worker health approach. So importantly for this talk today is which strategy was most associated with the best employee engagement. And what I have laid out here is our, from left to right, the strategies that were most associated with employee engagement. So if you, you were in the business strategy and culture focused group, that organization elicited the best employee engagement. Employees were more engaged in the safety program and more engaged in your health and wellness programs. Businesses that fell into the business culture focused program, where they were focused on leadership and climate, but lagged in their business strategy, they actually still had really great employee engagement. But businesses that either fell into the beginner or the business strategy focused groups had lower employee engagement. So what this tells us is that successful businesses have a total worker health business strategy in place, as well as the leadership commitment to support it and the climate that supports its use in a day-to-day basis. But really what it's showing us is leadership and climate are the factors that drive employee engagement. So here's another poll. I'm curious what approach you would think your business is taking right now. Are you in the beginner group? Are you more focused on strategy? Are you more focused on culture? Or are you trying to focus on strategy and culture at the same time? So take a minute and answer this poll.
All right, looks like it's starting to slow down a little bit.
All right. That's awesome. Almost half of the folks on our webinar today are in organizations that are focusing both on strategy and culture. So that's really great to hear that you're focusing on both at the same time. So the question is, how can you guys use this information in your organization? I think the first step, if you haven't done this already, conduct a worksite assessment. I know that the theme for this webinar is employee engagement, but the way that we do that is first doing the assessment practices to understand what employee health and safety needs are. At least the way that we've thought about it, I think it's useful to do the Health Links Healthy Workplace Assessment. If you're part of Health Links, you do that automatically. If you're not part of Health Links, you can either join Health Links and do the assessment, or you can do your own audit of your health and safety practices in your organization. And then couple that with asking employees for their opinions about the health and safety programs in your organization and leadership's commitment to it. Gathering those pieces of information to understand where you're at right now, and then using that information to act and set priorities. So I'm going to go through some recommended actions for each approach, depending on where you may find your business at, either in the beginner approach all the way to the business strategy and culture focus, with an eye to how can we help increase employee engagement. So if you find yourself in the beginner group, I think the best place to start is to do the work to understand your health and safety strengths and opportunities, but do so in a way that encourages both leadership and workers to have a say in the process. So starting a conversation with employees and leadership about why health and safety is valued in your organization, making total worker health a part of your daily conversations and meetings or informal get-togethers, doing an assessment analysis to understand health and safety needs, and working together with employees and management to collectively set priorities and start to address total worker health. If you find yourself in a business strategy focused approach, the focus that needs to happen is on leadership, building leadership support. So focusing on building it from the top, senior management, all the way down to supervisory levels. And one of the things that you can do is communicate to them what you've learned in your employee health and safety culture surveys, or what you've heard in discussions with employees. In our leadership programs, this piece of information always is seen as really valuable and important and eye-opening. And so at the same time, you're going to have to build the business case for why total worker health is important for your organization and communicate that to your leadership. And finally, think about providing some education or training for your leadership on how they can demonstrate their support for health and safety in your organization and how they can do so consistently. If you find yourself in a situation where you have a great culture, you have the leadership to support it, and employees feel like their health and safety isn't valued, what you need to do is focus on your business strategy. Conduct a workplace analysis to understand your health and safety needs, collectively set priorities on what needs to be addressed first. Take a chance and experiment with a new policy or program. If it seems daunting, like a lot needs to happen, focus on something small that you can start with. Start on one policy, execute it, evaluate it, and adjust as needed. And finally, if you're in a situation where you're really excelling at your strategy and culture, you're not done. You need to focus on continuous improvement. Embedding evaluation into your total worker health approach in your organization, adjusting policies and programs as needed. Things change in your organization, work changes, people change. And so it's safe to assume that you're going to need to update your policies and programs. And finally, maintaining leadership commitment. You may have it, but maybe leadership changes in the organization, and new folks need to be educated on total worker health initiatives and how they can consistently display their commitment to health and safety. So in summary, I hope that you've learned that you can use assessments to drive total worker health decision making at your organization. Assessments around your business strategy for total worker health, but also assessments asking employees for their perspectives on leadership and climate. And I think importantly, what our research is showing is that with any action you take around your business strategy, you need to ensure that there's leadership commitment to those strategies and that their employees are perceiving that these strategies are supported on a day-to-day basis. And this is because they'll have more internal motivation to participate, and they do actually participate in these programs. So I just want to mention a few resources if you're interested in exploring what we've been talking about today more. The first thing you can do is sign up for a HealthLinks premium plan to take the assessments I talked about and get advising on them. If you are interested in building leadership support in your organization for health and safety, you can participate in our total worker health leadership programs. They range from having a completely online training that's self-paced that you can participate in, to having shorter workshops that help you goal set for your leadership strategies, to an executive style program that lasts for a few months where you get personalized data and feedback. And the final resource is that if you're interested in learning more about total worker health, you can enroll in our certificate in total worker health program at the Colorado School of Public Health. We have scholarships available for students who wish to participate. It's a 15 credit hour online program that can be completed in a year. And the next deadline for that is February 15th. So thank you so much for your time. If you have any questions, I'm happy to answer them offline. And I look forward to chatting with our panelists more about this.
Awesome, thanks so much, Natalie. And I believe Kira posted this in the chat, but if you have any questions, please put those in the Q&A and we will get to that after the panel discussion. So great, I'll now transition to our panel discussion. Really excited to have with us today Anna Stout from the Royce-Hurst Humane Society, Amir Janisar and Amy Askin from the Active Pharma Group. Also wanted to give a congrats to our panelists because these two organizations were finalists for our Dedication in Small Business Award at our HealthLinks Award annual ceremony. And Active Pharma Group ended up winning that award. So congratulations to both of your organizations.
Thank you.
We'll start with just a brief introduction. If you can just tell us a little bit about yourself, what you do, and about your organization. And Anna, we can start with you.
Great, thanks so much, Katie. Yeah, my name is Anna Stout, and I am the Executive Director of the Royce-Hurst Humane Society in Grand Junction, serving Mesa and Delta counties. And basically, we are a nonprofit animal shelter, but we're more than a shelter because we really focus on the role of animal shelters and shelter pets in overall community health and well-being. And our organization is we're currently about 16 people after some pandemic-related attrition cuts. So normally we're about an 18 to 20 person organization.
Seeing a lot of that, unfortunately, with our small businesses that we worked with in the SWELL study. All right, Amir and Amy.
Thank you, Katie. Good morning, everyone. My name is Amir Genosar, and me and Amy Askin, we are with Active Pharma Group. We're a special medical company, and we're developing drug products in proprietary pre-filled delivery systems that emphasize safety, ease of use, and drug stability. We're about between 50 and 60 employees in the organization. Amy, anything you want to add?
I don't think so. I think you said it all. But we're just very excited to be here and extremely honored to have won the award. And yeah.
Great. So we can stick with you, Amir and Amy. Can you tell us a little bit about what total worker health means to you and your organization?
Ooh, I think we decided this was you, Amir.
Okay, I'll take it. Yeah, I think we're taking a very holistic approach to health and safety for employees. Starting from the obvious, we have a very comprehensive medical care plan for employees. So access to basic medical care is where it starts, but we have a very holistic approach to health. And again, it starts from the snacks that we're offering our employees to the gym membership and just emphasis on healthy living. But more importantly, we're trying to create a safe work environment. We're really looking to create an environment where employee gets to the parking lot and switch their engine off, and they're excited and eager to go in, meet the team, be part of our journey. And so we're taking to make it happen and give the employees a sense that they have control on their life, on their workday, on their responsibilities. One of the tools that we're using to give that sense is an unlimited vacation to employees. And of course, there's a few contingencies to that, but the idea behind it is that we give the employees a sense that they have control in their life and they can do their work in many different ways that personally fit their lifestyle, their circumstances, daily situations. The ultimate message to our employees, and we continue to emphasize it, is gratitude to be able to tap into their talents and be part of their life journey. So it's more about them. And with a recognition that one day they might be working somewhere else, and that's their life journey, and we always their best interest is in their best interest is in our mind. And we again, there's a lot of small things we do to make sure people understand that. For instance, one of our operation agreements says that looking back at our experiences together and with our customers and partners, we would enjoy living it all over again. And it's something that is nice to remind yourself every day. It's hanging on the wall in the office, and that this is what we're trying to do. So find that right balance. Don't kill yourself for it. So we're a startup company, so there's some tensions. We do have very aggressive milestones to meet. So it takes a lot of discipline to keep the two together. And then after them, the second in priority is the user, not management. So the people who come and work for this company need to take good care of themselves but then think about the end user of our product. Some of the products we make are life-saving medicines, and we want it to be designed and made in the best way for the end user, and not focus on the business or profit from the business. So I can say it's very rewarding to run a team like this. And
Wow, that was great. Thank you so much, Amir. And Anna, do you want to share a little bit about total worker health at Royce First?
Yeah, I mean, I think much like Amir and his team, we look at our employees not as employees, but as people, right? And we really want to make sure that coming to work is an enhancement to their overall personness. So, it was really telling for us that we've, of course, because of the pandemic, we've had a number of people who have been either quarantined or otherwise have had to stay home from work waiting on test results. And, we had one employee who has been with us basically since I started, and she was just champing at the bit to get back because work is her wellness. And that was one of the things she kept telling us is, I can't wait to get back to work. I can't wait to get back to work because she comes to work to escape, the stressors everywhere else. And that for us is what we're really going for, is that when you come to work, you're growing as a person, that the organization really prioritizes you, and whether that's your desire to learn new things or that's your desire to be supported in really having a strong family relationship, and the organization doesn't take away from that, but rather really builds into that. Whatever that priority is for you and what makes you a whole person, that's what we want to focus on providing in the organization. So that's really, we never, really refer to people as employees or as workers, because they're part of a family, especially in an organization our size. When we have somebody who's not well, that ripples through the whole entire organization. Whether that's right now, we have somebody who is we have 2 people who have tested positive for COVID. That really impacts the organization. But in the same way, when somebody is not well emotionally or not well mentally, it ripples through the whole team. So it really matters to us that we're there as a support system for each other, and constantly, reinforcing this idea that you come to be whole. And if you're not whole, we as a team will help do everything we can to put additional pieces together for that.
That's great. Thank you, Anna. And it sounds like the cultures at both of your organizations are phenomenal. So great to hear about that. Anna, could you tell us maybe a little bit more about some strategies that have been successful in engaging your employees?
Well, one of the things that we do, we have something, this came from my childhood. My mother had this thing called Forced Family Fun, where we as a family had to get together and do something together. So I brought that with me to this organization, and we do Forced Family Fun as a team. So there's no opting in to our culture. You don't get to choose whether or not you focus on prioritizing your safety and your wellness. It's something that you're forced to do. And part of that is that we just make sure it's an element of everything we do. Every staff meeting we have, we open with 2 minutes of gratitude, where everybody just gets a moment to sort of come to center and focus on what they're grateful for. Sometimes that's directed, where we'll have it be related to something. Sometimes it's just general, but we start with that so that it's at the very top of our agenda, and it's written on the agenda, and it's a standing item. First, we do our gratitude. Then we have a wellness topic that one of our staff members is assigned to really research and present. So making sure that it's always top of mind is, I think, a really key component of how we've managed to keep people engaged. But we've also empowered people throughout the organization so that it's never a top-down wellness and safety culture, but rather it permeates the whole organization. So we have this a card, a pass to the butterfly gardens, which is not too far from our organization. And when somebody on staff sees somebody else escalating or reaching threshold or just otherwise like really stressed out, anybody is empowered to go to that drawer at the reception desk, grab that card and hand it to another employee and just say butterfly break. And it's not optional. And it's a kind of a tacit understanding that, hey, we've got this. Everybody here is going to pull together to give you 15 minutes to go just center or just remove yourself from a situation. So, giving just giving employees permission to participate in it without feeling like they're, oh, if I leave, I'm going to be in trouble. There's going to be some perception that I'm not prioritizing my work or I'm not a team player. We've given everybody this, instruction to be a guardian of everybody else's wellness and of their own.
That's really neat. I love the idea of the butterfly break. I grew up in the customer service. It's the only people breaks were the ones who smoked. So I love to see that you can kind of take that and turn it and make it a healthy break. And I would personally love that sort of thing. Amy and Amir, do you want to talk about your strategies?
Yeah, I can talk to that a little bit. Anna just wanted to say that I absolutely love that idea as well. And the 2 minutes of gratitude before your all staff meeting, how cool is that? But I think the number one way that we at Active engage in our total worker health is by having our leaders like Amir and our other VPs show just from the top down and model the behavior for everyone. Like, one of the coolest things that Amir does is he takes a month off every year where he completely disengages from the business, doesn't answer phone calls or emails, and just spends the time, again, recentering, being with family. And I think a quote from our VP of product development is, you're doing a great job when you can step away for vacation and your team is set up to help take care of everything while you're gone. We also have a ton of committees. We have our DEI committee, which, like Amir was saying, just really fosters the inclusivity, safety while at work. And we're always continuing to look for ways to, be more inclusive, make sure that everybody is happy and safe here, and that we're modeling those safe behaviors as the DEI committee and as the leadership team. We also involve our DEI committee in all of our interviews. And then we have our culture committee, which does cool stuff like Anna was talking about, bringing the whole group together to do, whether it's frolfing or going for a happy hour or whatever. I think our little committees really bring a lot to the organization too, to empower people to continue to stay healthy and do fun things like that. So, Amir, anything you want to add?
Strategies. Well, it's a pretty easy message when you tell people that it's about them and we care about them. So I'm hearing that even in job interviews, people are already introduced to the culture and these policies, so they come in ready, excited, knowing that already received the message about this. I think from there on, you need to continue building the trust that there's no catch in that. Yeah, you have unlimited vacation. What's the catch? You don't mean that I can just stay at home and vacate that entire year, right? So how do you manage the different interpretation, but make sure that people understand this is honest? So one thing we're doing now, and we are hoping to start next year, is the forced month off for every employee. Just to continue emphasizing, we can cover for you if we work collaboratively enough. We can cover for each other and make sure that everyone gets at least a month off every year. And so that message keeps, you can keep building the trust that there is a real intention behind the employee-centered culture.
Yeah, and I think just to tag on to that, one of the things that is really critical is that, the culture doesn't start once somebody's hired. It starts in the recruitment process and in the interview process. So we make sure that this is part of our interview. We want to make sure that we're hiring people who are bought into this. And, from the get-go, understand, we kind of joke and say, like, hey, if Kumbaya makes you uncomfortable, this may not be the workplace for you, because we really focus on, we do we do meditation together in meetings when you've got that sense that everybody's kind of like up to here, we'll just stop and do some mindfulness meditation and some breathing. And so it starts at the very beginning, and that way, when you're bringing people in, they know that they're a part of that they're part of reinforcing it, they're part of bringing that, and that if that's not something that is appealing to them in an organization, that we're not the right place for them. And that's, I think, really key. And that messaging starts early on, so that, you don't hire and then say, by the way, you matter to us. From the very beginning, that's the messaging that they're receiving, that this is crucial to us, and it's non-negotiable in our organization.
Awesome. Thanks so much. And Amy, thank you for bringing up how Amir is walking the talk. That's something that we bring up a lot in Health Links, is how can leadership really show their support by doing it themselves. And sometimes it's a little bit easier for leaders to be involved by, going to different activities or talking with employees, but sometimes that stops when it comes to vacation time or disconnecting and getting away from your email. So it's great to hear that, Amir, you're able to model that behavior for your employees to really encourage them to also take time off and disconnect so that they can come back recharged. Well, thank you so much. I wish I could ask more questions, but I want to make sure we have lots of time to get to the audience questions. So I'll invite Natalie to pop back on. Again, if you have questions, please use the Q&A function. And one question that I saw right away that I was actually excited to talk to you all about is about if you have any recommendations for engaging employees currently, given the pandemic, if you have employees working remotely. I know a lot of people have struggled with being able to engage their employees right now. And while you're answering that, I also wanted to pose this question to the audience. So if you have done anything that has been really successful, we would love for you to put that in the chat so everyone can see. Make sure you send that to panelists and attendees, and then we can all kind of hopefully get some ideas from everyone. So I don't know, Anna or Amir and Amy, if either of you want to start.
Yeah, I think it's hard because the default is, well, just have more, do something on Zoom, bring people together. But I think we're trying to be very intentional about how often we are asking people to join, so that when we do have to do this screen time together, we can be intentional about it. We can, it doesn't become an additional obligation or burden. And the other, we're really trying hard to make sure that we can send little reminders out so people can still come. We're an essential business as an animal shelter, but not all of our employees actually care for animals. So a lot of them are working from home, but during the election, we put together election week care packs, just because regardless of your politics, it was an intense week, I think, for everyone. So it was really simple. One of our team members who just loves doing crafty things put together this bag, and we bought really simple, cheap stuff. We bought bath bombs, a stick of incense, I don't remember what all was in there, cookies, a little dice that she made that just, you roll the dice and it's got take a deep breath, go for a walk, like different wellness options that you can do when you're just hitting that point, and little cards to put on your screen. That's just a reminder. We had a couple different messages like your energy is your currency and how you talk to yourself matters. So we've just put together some little gifts here and there that just remind people. But I think the other thing is we're being really intentional as leadership to reach out to people and ask people, making sure that people are putting boundaries around their work time. And we did this early on, asking people to be really intentional about when they were working, but reaching out and making sure that people are okay, because a lot of us are not okay right now. And I think just acknowledging that we're all struggling and we're all activated all the time right now. So our leadership has been extremely intentional about just reaching out directly and asking people where they're at, where they're at emotionally, where they're at, what resources they need, whether that's something the organization can provide or not. It's still engaging people in goal setting and in an active reflection process about what this year has meant and what opportunities it's brought and what positive things have come in. So I think it's, in that sense, leadership is really needing to be, scheduling time to be intentional.
Amy, I'll let you take this one from our end, because we're doing such an amazing job dealing with this
Yeah, so I think at the beginning, more so of the pandemic, we did, something really similar to what Anna said about the election care package, but it was like a COVID care package. And I think that was really cool. It was kind of like when the mask mandate started to come out and we, bought a bunch of masks for everyone. Again, we're an essential business, so we made sure to make sure that people feel safe. We hired a full-time cleaner. We have, like stations set up at every single door with, like any sort of supplies anyone would need to make sure that they feel safe coming into the office. We definitely make sure that we take care of any of our staff members who have come down with COVID, or that, like if their spouse or somebody in their home has come down with COVID, sending soup and groceries and flowers and, anything comforting that we can do. I actually myself had COVID and got to experience the wonderful, groceries at the doorstep and everything. And it's pretty incredible. And I think it definitely makes you feel as an employee that you're really cared about, and that, they want you to do your best to get better and be able to bring your whole self back to work.
Yeah. With Amy's care, we are concerned that people will start faking COVID.
Yeah, definitely.
We've also put together some activities. There was during October here, at least in Grand Junction, was declared, we had a proclamation that it was Random Acts of Kindness Month. So our staff put together like a bingo card for different acts of kindness that people could go out and do. And we funded, like the organization we bought like chalk so that people could go out and do chalk art in front of people's homes and businesses, thanking them for existing. And there are some activities that can be done that are still really socially distanced, but that everybody can participate in together. That doesn't have to cost any money. I know a lot of us, there are very few businesses right now who I think are like, yeah, awesome. This pandemic means we've got a bunch of extra money to spend on staff things, right? So even if you're really taking it from this like zero budget approach, you can still, there are activities that you can do where people are doing the same thing together, though not at the same time and not physically in the same place, but it really does bring people together around a common, activity. And when it's kindness related or wellness related, it has that additional benefit of bringing, health and wellness to you from just participating in it and doing those activities.
If you have time, one more comment, and an area that Amy is really doing an amazing job is, there's not one solution fits all here. It's so personal how people are taking the situation. We have the two extremes of people who are uncomfortable coming in, but they're essential employees, and we really need to find a way to get them in at least part of the time, to those who are not essential but are experiencing anxiety not coming to work. And each one of them has to be really need to get the right attention and personal solution for their situation.
Thank you so much for sharing those strategies. I was just going to read a couple from the chat out loud too. So Sandra mentioned that at her VA, they have weekly online reflections or meditation meetings. She said it's not mandatory, but is highly recommended or highly attended. Lots of kind of end of year celebrations, some different contests that people did. I think I saw, a pumpkin carving contest. What we've done at our organization that has been somewhat fun is a scavenger hunt. So just to get people up and moving, kind of listing funny items that people can go grab around their house and bring back has been fun. Kendra mentioned that they have a weekly team meeting every Monday, and to engage their team while working from home, they have each team member lead the meeting. And they can share photos, stories, pose a question or a discussion. She says it's a fun icebreaker to start every week on the right foot. Awesome. There's lots of good ideas in the chat, so thank you for sending those. Next question I have is, can you tell us how you are incorporating occupational safety into your efforts to promote health among your team?
I think I'm, are you asking us right now? Sorry.
Yeah.
Okay. Like, I didn't know if this was going for the people in the
Yeah, whoever wants to take a stab.
We have kind of taken it upon ourselves for safety aspects to have one leader from pretty much every one of our groups. We've got a few groups, although we're only about 50 employees, and that leader comes to our meetings every week. We have like an employee health and safety meeting every week, and we all, as a big group, do a walkthrough, like of the buildings and the safety, and take notes together so that we can understand like what's important from a safety perspective for each group. Like for me on the administration side, I'm not going to know so much what's important for like our machine shop or the manufacturing team and things like that. So I think getting the perspective from all of the different groups has really helped us, instead of just having like myself and one other person. And then we're able to bring it back to our small groups before we meet again to kind of address the issues per se.
Yeah, I mean, safety, it's interesting because the fun part of total worker health is the wellness part, right? The feel good stuff. The safety part is the stuff that I think you have to be really intentional about, and we've had to do that. But again, it's we have it built into our agenda. So right after wellness, we go into safety, regardless of what's going on and what we need to discuss, and any fires we're putting out at the organization. Everything comes after we discuss first wellness and then safety. And just like with our wellness topics, we assign those to different, that's sort of the entire organization at some point, you have a topic that you have to present. So that's meted out to staff. And, some of it is really topical to some, in response to something that came up or a question that was had, or in this, with disease control protocols right now, especially through the lens of COVID. But we just make sure that it's built in and that everyone has a part in presenting on it, choosing a topic, presenting, researching, and then presenting that topic. And we have one person who's the point person who makes sure that happens, that everyone is prepared to present their safety topic. So we do have sort of some structure around it there, but then it happens organically within the organization. And, the research shows that if you teach something, you learn it better. So that's one of the reasons that we have different employees decide on topics that they want to present. And it really, again, it makes it part of that, like it permeates the organization. Safety is not something that just the safety manager comes in and does. It's not something that you just do, like when something comes up, but it's something that we're hammering on every time we all come together to have a meeting.
I love that idea of getting everyone involved and learning a topic so much that you can teach it. That's great. I'm just going to do a couple wrap-up thoughts, but Natalie, wanted to turn to you just to see if you had any final thoughts for us.
No, I answered a question in the Q&A about whether the results I presented are applicable to larger organizations, and I would say just absolutely. But you may need to look at your strategy and your leadership and your climate by different departments or locations, because I expect there may be varying levels of how folks are doing it depending on those different groups. But absolutely, these are applicable to larger organizations.
So much. And thank you to all of our panelists. It was great having you here. This hour flew by. I wish we had more time to ask questions. I'm just going to quickly share my screen and just go over a couple of things for you before we close out today. Oop. So as Natalie mentioned before, HealthLinks is available to all of you if you aren't currently in our network. We have plans starting at $180 a year, so we want to be really accessible to all small businesses. You can actually reply to any email you've gotten about the webinar, and that will go to me, and I'm happy to answer any questions that you have about this or chat with you briefly on the phone. We would love to get you enrolled. And then lastly, just want to say thank you. Again, there will be a survey that will pop up as you close out of this. We would love for you to take a minute to complete that. It helps us to develop our future webinar series. Again, this is the last one of 2020, so thank you all so much for attending, and hopefully we'll see you back in 2021. If you're looking for CHES credits, you can take that survey that pops up, and there will be a little quiz portion, and that's how you will do that. We'll also have a follow-up email going out tomorrow with a link to the recording, information on how to claim the credits again, and some resources for you as well. We have our email up on the page here. Again, you can reply to any email you've gotten about the webinar. And thank you so much. I hope you have a great rest of your Wednesday.